From Penn State Health, Milton S. Hershey Medical Center, you're watching Ask Us Anything About Endometriosis. I'm Barbara Shindo. According to the American College of Obstetricians and Gynecologists, 1 in 10 women are affected by endometriosis. Today, we will learn a little bit about diagnosis and treatment options for women with endometriosis. I am joined by Dr. Tim Deimling with Obstetrics and Gynecology at Penn State Health. Dr. Gerald Harkins was going to join us as well, but he is in the OR today. So we are here with Dr. Deimling. We welcome your questions for Dr. Deimling about endometriosis, whether you're watching this live or if you're watching on playback. Just type your question in the comment field and we'll get an answer with Dr. Deimling for you. So thanks very much for joining us today.
Thank you very much for having me.
So let's start with kind of the easy one. What is endometriosis, and are there different stages of this disease?
Yeah, no, I agree. This is a good place to start. So if we think, what is endometriosis? If you look at a textbook diagnosis of endometriosis, it's going to say the presence of glands and stroma outside the uterus. But what does that actually mean? What we're talking about when we say that are these are the 2 cell types that make up the normal endometrium, or the lining inside of the uterus. And that's the part of the uterus that builds up and gets nice and thick in preparation for pregnancy. And if you don't get pregnant, then that breaks down and it sloughs off, and that's when a woman has her menstrual cycle. Well, if these cells begin to grow anywhere in the body they're not supposed to be, that by definition becomes endometriosis, and it's made up of those 2 cell types. And yes, there are stages of endometriosis. So there are 4 stages of endometriosis, 1, 2, 3, and 4. And the amount of endometriosis and locations of endometriosis tend to be worse the higher the stage is, with 1 being the least and 4 being the most significant. Interesting thing about staging is that many women's symptoms don't really correlate with stage. So staging is really, as much as anything, a way for one physician to talk to another physician about how the endometriosis is distributed in the pelvis. But there are many women that will have stage 1 endometriosis with very debilitating pain symptoms, and other women may have stage 4 endometriosis and they may not even know that it's present. They're not having really any symptoms from it. So the staging is important, but it's something not to get too hung up on.
Okay. That's useful. How does somebody know if they might have endometriosis? What are the symptoms they should be looking for, and how do you diagnose it?
Yeah, so, the classic symptoms of endometriosis are cyclic pelvic pain associated with your menses. Oftentimes it's the week right before, and sometimes the first part of your menstrual cycle where the pain is most significant. And then many women will have some period of time where they'll have like a reprieve from symptoms following their menstrual cycle. What we do find is that the longer a woman has endometriosis, oftentimes it begins to happen earlier in the cycle and lasts longer in the cycle, to where they can eventually get to a point where they really have very little time without pain associated with it. The diagnosis is very challenging, and this is one of the reasons there's often delays in diagnosis, is because we don't currently have a blood test or urine test. It doesn't tend to show up on ultrasound, MRI, or CT scan. So there's a big challenge. So they have the pain that's predictable, but the evaluation, unless somebody's looking specifically for that or thinking specifically about it, is very challenging. So the definitive diagnosis of endometriosis is done with surgical excision and pathologic evaluation. So that's how we get the definitive diagnosis. But for many women, we're able to offer relatively low-risk treatments based on the classic symptoms without having to have a surgery before we initiate treatment.
So I had mentioned that 1 in 10 women suffer from endometriosis, and you had mentioned that it can be a little bit challenging to diagnose. And I've also, one of the things that I've heard about it, and I think a lot of folks have heard about it, is that a lot of women have felt like they're being brushed off when they're talking with a doctor or provider about their symptoms, and they're kind of saying, "Oh, that's normal menstrual pain. There's nothing wrong." What kind of advice do you have for women who say that if you feel they're not being taken seriously and that they're just kind of being brushed off?
Yeah, I think this is a very important point. As you mentioned, there's often a delay in diagnosis, and for many women, this is 6 to 10 years of symptoms before they get the diagnosis. I think the most important thing for women with endometriosis is advocacy, and the most important first advocate is yourself. So you've got to advocate for yourself. Information is at everybody's fingertips right now, whether it be on Facebook, whether it be anywhere else. And so women in general, and all of our patients in general, are becoming more educated. And so advocating for yourself and asking those questions and feel empowered to ask the questions in the clinical visit, because if your provider is not willing to address those questions, then maybe it's time to find a provider that will address those questions and is at least willing to talk about it. So I think that's the key, is feeling empowered to ask questions and seek treatment.
Okay. You're watching Ask Us Anything About Endometriosis with Dr. Tim Deimling at Penn State Health. We welcome your questions for Dr. Deimling, whether you're watching now live or if you're watching later on playback. Just type your question in the comment field, and we will make sure to get an answer for you. So one thing you had mentioned is finding a provider is an important part, and we are going to, I just want to let folks watching know that we're going to put some information in the comment field about how to, if you think that you may be suffering from endometriosis, or you think if there's somebody here you'd like to make an appointment, we can put that information in the comment field for you, so there will be a number for you to call. So after a woman is diagnosed with endometriosis, what are the treatment options?
Right. So really, initiation of treatment with a diagnosis is all about reducing inflammation. What we know about endometriosis is, one, we really don't have a cure at this point. So we often tell women in our clinic that at least at this point in time, endometriosis is a forever diagnosis. And what we spend is a lot of time learning how to improve quality of life, manage symptoms to make this much less impactful. But knowing that even under the best of circumstances, once in a while endometriosis will have a tendency to remind you that it's there. But the first line treatment for endometriosis is really trying to suppress the menstrual cycle. And the reason we do this is, as I said, it's responding to inflammation. The most common recurrent source of inflammation in a female's pelvis tends to be their uterus right before it bleeds. There's a lot of inflammation that happens there. So if we can suppress the suppress the menstrual cycle, and we're not getting this recurrent source of inflammation stimulating these nerves around these endometriosis lesions to send that knife stabbing and twisting pain that these women often report, then that in and of itself can often provide some significant symptomatic relief for a period of time. Mm-hmm. There are other medical treatment options. So we often will talk about medications that will treat specifically neuropathic pain. This could be medications like gabapentin, Cymbalta, those kind of medications. Or if you're a combined oral contraceptive pill, which is what we oftentimes use to suppress the menstrual cycle, so just a regular birth control pill, but you take them in a different way. You take them in such a way that you skip your menstrual cycle every month to avoid that inflammation.
And that will help avoid some of that pain and some of that.
Absolutely. And then
I just want to quick mention, if any of you are hearing the very loud noises, there is construction happening right above us, so nothing to be concerned about. So I'm sorry to interrupt.
No, that's okay. And then, so those are some of the medical options for treatment, and then there are also surgical options for treatment. So as mentioned before, surgery really is the way we diagnose the endometriosis, but it can also have a therapeutic benefit. So if we excise these lesions of endometriosis, that does offer symptomatic relief, but often you get your best long-term results with some combination of both surgical intervention along with hormonal suppression to really give you your longest interval of time without recurrence of symptoms.
Mm-hmm. And I think we have a question here from a viewer. Wanda wants to know, do providers believe that endometriosis pain will end after a hysterectomy? Or she says she's been told that is not possible. If somebody gets a hysterectomy, will that take care of all their pain?
Thanks for writing in your question, Wanda. That's a great question. So what we know for certain is that, like I mentioned before, we don't have a cure for endometriosis. And there are providers, and that we've seen circumstances too, where it will be implied that because you've had a hysterectomy with or without the removal of your ovaries as well, that this pain cannot be associated with your endometriosis any longer. And what I can tell you is that we see the opposite of that frequently, to where women who have had hysterectomies, women who have had removal of their ovaries, will still have active endometriosis lesions and still have symptoms. Many times after a hysterectomy, you do get improvement in your symptoms, but that goes back to what I mentioned before, because the uterus is such a source of inflammation in the pelvis that removal of the uterus likely decreases that recurrent inflammatory process and gives symptomatic relief. So many women will report improvement of symptoms after a hysterectomy, but it doesn't guarantee that you'll never have symptoms again.
Mm-hmm. And we do have another question too from Pamela. She wants to know, you had mentioned this a little bit, but I think this is a little more specific. Is diagnosis for endometriosis only made laparoscopically?
Yeah, there are. That's the most common way to diagnose endometriosis for sure. You could technically do it via laparotomy as well, which is a big open incision. But at this point in our society, most gynecologic surgeons are doing everything laparoscopically and should be able to get a diagnosis just with laparoscopic surgery. There are a few circumstances in which you can diagnose endometriosis without laparoscopic surgery. There are a couple of cysts that form on ovaries, for example, an endometrioma, which is a very classic appearance on ultrasound, where you can have a high enough suspicion that you feel comfortable saying, yes, this is your diagnosis, just based on the ultrasound, but that's a very small subset of patients. We're routinely saying, like, we're going to treat you for endometriosis independent of whether or not we know for sure you have it, because even if it's not endometriosis and it's cyclic pelvic pain, you tend to have similar benefits. Okay, but if we get to a point where we're in a treatment pathway and you're not responding to these treatments, a lot of times at that point we'll for sure say, hey, maybe we should do laparoscopy and make sure we're actually dealing with what we think before we continue to progress down the treatment pathway.
Okay. You're watching Ask Us Anything About Endometriosis with Dr. Tim Deimling. We welcome your questions for Dr. Deimling. Whether you are watching here live or you're watching on playback, we will get an answer for you. And if you feel like the information in this if this Ask Us Anything About is very useful or could be helpful to somebody you know, please feel free to share in your own timeline. And I want to go back to, we had talked about some of the treatment options, and one of the options you had mentioned was surgical treatment. So how can you know when surgery is needed to treat endometriosis, and, you know, what kind of surgery is it like?
Right. No, this is another good question. That's such a personalized decision. And so one of the things we strive really hard to do here is take every single individual and have an individualized treatment plan for them. And, you know, there's a dialogue that occurs between us as the provider and the patient that's really important in making that decision as to how much is the endometriosis impacting their quality of life, what are the anticipated long-term outcomes from surgical intervention, and how are we going to also continue to manage after surgery to decrease the likelihood of needs for, you know, multiple recurrent surgeries. But so that decision is oftentimes based on if you're having refractory symptoms in spite of treatment, then you will consider looking again to say, hey, you know, do we need to do some excisional process in conjunction with this to improve symptoms? Or, you know, at some point, if a woman has been trying multiple different treatments and different excisional processes, then that also the discussion of, you know, what are your fertility desires? Do you want to move with a hysterectomy or something like that to help alleviate symptoms more long term? And
is most of the surgical procedures for these types of treatments minimally invasive?
Yes, here we do over 97% minimally invasive for these types of procedures. Rare is the circumstance in which you would have to do a laparotomy, and that's great in multiple reasons. But you have lower infection rates, you have lower length of hospital stay, you return to work much more quickly, on the order of half as the amount of time needed if you have to do a larger incision. And so here we strive very hard to accomplish all of these surgeries with a minimally invasive approach, whether that be laparoscopic, robotic, or vaginal.
Okay. And on top of surgical treatment options, other treatment options, I know that here at Penn State Health and at the College of Medicine, you are also working on a lot of research related to endometriosis. Can you tell us a little bit about that?
Yeah, that's the part I am always excited to talk about. We think it's very important to be at the forefront of the treatment of endometriosis here, but we also think it's important that we contribute to the development of new information. As we've talked about before, we don't have a cure for endometriosis. It's a very challenging disease to diagnose, and so we have multiple clinical trials that are ongoing now, some of which we've partnered with industry to look at new drugs that would be available to treat endometriosis, and we also have other studies that are ongoing looking at treatment options that were developed by us, where we're having funding from the National Institute of Health to evaluate treatment options. We've also had studies in the past where we've partnered with other institutions, gathering tissue and gathering demographic data to try to see, can we develop some biomarker or can we develop a non-invasive test that would help us lead to the diagnosis. So we are always looking for providing the opportunity for local women or regional women to participate in these studies so that they can, one, be at the forefront of what treatment options are available, two, help contribute to a disease process they're all very frustrated by.
Mm-hmm. And we will also put in the comment field here, as Dr. Deimling mentioned, multiple ongoing clinical studies. We'll put information in the comment field about how to find out more about those, if that may be something you are interested in, or perhaps you know somebody who may be interested in participating in a study. We have another question from Pamela, and Pamela wants to know, do you feel like diet could relieve pain from endometriosis? Changing your diet, would that be helpful?
Yeah, I think the short answer is yes. The longer answer is we're not exactly sure how. I think that is somewhat individualized for women as well. We do know that inflammation plays a role, and there's more and more data saying that the food we eat impacts how our entire gastrointestinal tract function and just generalized inflammation in our bodies. So we're oftentimes telling people to try to follow some version of a low anti-inflammatory diet, or also doing things like keeping a food diary to say, hey, I notice if I eat X, Y, or Z on a regular basis, then that helps, then that exacerbates my pain, right? So it increases my pain, or makes me more likely to have a flare. That's most likely related to just localized inflammation in the GI tract related to what food you're eating, that in somebody that doesn't have endometriosis, they may not have this pain symptom. Right. But when you're already sensitized and to this inflammatory process in the pelvis, that can really cause some major problems for endometriosis.
Mm-hmm. One of the other things you had touched on briefly was talking about fertility desires and that how that becomes a part of the treatment plan. So will endometriosis affect a woman's ability to become pregnant?
Yeah, endometriosis absolutely can affect the ability to become pregnant, but it's also important for women with endometriosis to know that they can still become pregnant. We have seen cases where women have been told, well, if you have endometriosis, you won't be able to get pregnant, and so then they don't use mechanisms to protect themselves from pregnancy, and so then they unexpectedly become pregnant. But many women with endometriosis do have the ability to get pregnant and have the ability to get pregnant spontaneously. If we look at numbers, around 40% of women that have infertility will also have endometriosis. So we know that it plays a role. But by far, most women with endometriosis are able to have children. And if you're if you are going for laparoscopy or having other things done, something that we also tend to evaluate at the time of laparoscopy is we want to evaluate your anatomy. We want to make sure that your fallopian tubes are normal in appearance, your ovaries are normal in appearance. And there are other things we can do, like flushing the fallopian tubes with a saline or a dye to make sure that they're open, and these can help improve pregnancy rates and give us some real information to give back to that individual patient about what we would expect for their fertility.
Okay. You're watching Ask Us Anything About Endometriosis with Dr. Tim Deimling. Dr. Deimling has been offering a lot of very useful and helpful information about endometriosis. Anybody with questions about it, or anybody who would like to maybe make an appointment or speak with a provider, we will put the information where to call in the comment field here. So what kind of support networks are available for women who have endometriosis? I know one of the things that we do here is Hershey Medical Center hosts a conference every year. Can you tell us a little bit about that?
Yeah, we're very excited. This is actually our fourth year, but our second year of having this conference in a slightly different format. We're putting together a 2-day conference that's going to serve dual purposes because we really felt there was a need in the region for both. It's going to be March 27th, March 28th. And the first day of the conference is really focused on educating regional providers. So what we're trying to do is we're gathering experts from all around the region. So we have representatives from major universities from all around the region that'll be coming and speaking about endometriosis because this is what they're passionate about and what they do at their home institution. And our goal is really to educate providers in the region, whether it be nurse practitioners or midwives, family physicians, OBGYN, general OBGYNs, or anybody that just has a patient or thinks that they might have patients with endometriosis. We want to provide you education about all the things we're talking about today, the diagnosis, the treatment, how are we capturing these women? How are we closing that gap in the delay of diagnosis, to shorten it from 6 to 10 years. And then the second day of the conference is really focused on the patient. Mm-hmm. So we bring in a lot of local experts, whether it be a nutritionist or a physical therapist, and ourselves are often involved, and oftentimes fellows, so physicians that are training in the specialty that we're training in. And our goal there is to provide education to the patients, but also to provide a platform where the patients can come together and mingle amongst each other. Mm-hmm. And so it's a relatively unique conference format. I haven't seen many like that, where you really have a dedicated day for providers and then a dedicated day for the patients to really expand the knowledge of the local community about endometriosis and its treatment.
Yeah, that sounds like a really fantastic resource, not only, as you mentioned, for providers, but also patients, not only to be kind of getting educated and learning some things, but also meeting a lot of people who are going through what they're going through. So they can find a vast support network there as well. And we can include some more information on that conference in our comment field as well.
Yeah, it was one of the unique things that some of the feedback we got last year is we do have lunch there, and at these lunches, our speakers all kind of go sit down at the tables with our patients, and it's a unique opportunity to kind of informally interact with the speakers that are there as well. So it's a great opportunity, hopefully, for patients to get information that they're craving.
Yeah, that's wonderful. We have another question. We have a question from Daisha. She says she was just diagnosed with stage 4 endometriosis with a mass constructing the fallopian tubes. What's the best option for her to become pregnant?
Yeah, I mean, I think that without seeing what's going on with the individual fallopian tubes in your specific case, it's difficult to answer because you really only need one functional fallopian tube to successfully get pregnant spontaneously. It sounds like in this case at least one of them is compromised, but it really has something to do with what the other fallopian tube looks like. What does the rest of the anatomy in your pelvis look like? So we do often recommend for our patients that do have significant amounts of endometriosis that we may end up having them seek the care from fertility specialists a little earlier in the process than we would a woman without endometriosis, just because we know there's a risk for some infertility there.
Mm-hmm. Thank you. And I want to say thank you to Dr. Tim Deimling for joining us today for Ask Us Anything About Endometriosis. We're going to wrap up the live portion here, but if you are watching this on playback and there's still something that you want to know that Dr. Deimling hasn't already spoken about or answered, please feel free to still put a question in that comment field, and we will get that to Dr. Deimling and get an answer for you. Thanks for watching.
Thank you.